I'm Dr. Anthony Galcerano. I'm here at my office, Wissahickon Chiropractic, which is in the Roxborough section of Philadelphia, Pennsylvania. And I'm going to show you a simple group of exercises that I give people who are in acute back pain. These are exercises that help to stretch areas that are in spasm for the most part. And they're easy and they're safe, and I'm just going to show them to you now. So, one thing that's very simple is the knee to chest stretch. And so what we do is just clasp the knee. You most likely have seen this before. And you, as you let the breath out, you pull it up toward your chest. And even if you're not in pain, you'll feel a nice stretch in the lower back. You'll actually feel the lower joint move just a bit, and the tendons and the muscles stretch as you're pulling down. So the muscles you're contracting are your arm muscles and your chest muscles, which are really not affecting the back muscles in that they're not causing them to contract. And you don't want those muscles to contract because they're already contracting abnormally. Now, if you can't get your knee up to your chest because you have too much of a belly, or you're just weak, or you can't get your arms far enough over, then simply get a towel or a belt and then pull your leg from the inside. And if you have knee problems, don't pull it from the shin, but just get on the inside of the thigh and pull up and allow the knee to be relaxed. And you do this leg, and you hold it. You can hold it for 30 seconds, you can hold it for a minute until you feel your back relax. You just hold it for 10 seconds if that's all you can manage. And you bring the other leg up. And you do the same thing, and you hold this for anywhere from 10 seconds to a minute. You can hold it for as long as you like. And again, if you have any knee trouble, come underneath it, or use a towel or a belt if you can't quite reach. The other, which is a little more strenuous, is to bring both knees to the chest. And this really feels good on the lower back. And again, if you're having any kind of pain when you do this, other than what patients call the good pain, the pain that feels like it's doing something good, which is mostly the stretching pain. So either the joints or the muscles that are tight are being stretched, and it hurts a little bit, but it feels good at the same time. That's the zone that you want to be in, and you stretch that. And for people who are in extreme pain, sometimes that's all I'll have them do. You do that 3 times a day, 4 times a day. You can do it every hour if it feels good. Also, if for certain kinds of problems, and again, the guide to use is your own body, whether or not it hurts. You bend your legs this way until the leg closest to the floor touches the floor. You have your arm extended this way, and turn your head toward the hand, and you'll feel a stretch all the way across your body. You're pulling on the latissimus muscle, which goes from your pelvis and attaches to your shoulder for one thing, and you're also causing a rotation of the joints in your lower back. That's why, for some people, this is not a good idea. And again, you have to use your own common sense and listen to your body. If it hurts, other than that tension pain that I talked about, don't do it. So you've got knee to chest, 2 knees to the chest, and the twist where you lay your legs this way and that way. And the other thing is what I call the figure 4. And you're making a 4. You're bending your knee, you're putting your ankle across your thigh of the leg that's touching, with the foot that's touching the floor. Now, what you do is you grab this leg. A lot of people make the mistake and pull this leg, which doesn't do you much good. You want to grab this leg and pull it up. And what you'll feel is a stretch from the side of your leg and the gluteals. And that will feel good. It'll stretch the hip rotating muscles too, which are often involved in the lower back pain. And do the other one. And give it a good stretch. Again, if this causes pain, especially if it causes pain to go down your leg, or any tingling or numbness, immediately stop. And that's a nice feeling of stretch. You could also use this elbow to sort of leverage this knee into more of a 90-degree angle, but that's more advanced, and again, if it hurts, don't do it. And that's a good stretch. So you've got one knee at a time to the chest, two knees, the twist, the figure four, and then you turn face down and do a push-up that isn't really a push-up. You're leaving your pelvis and legs flat on the floor, lifting your chin. It's an exercise in yoga that's called, there we go, a nice stretch here. And let it down. It's called the Cobra. Bring it up. And again, careful of your lower back. If it's hurting, don't do it. If it causes pain to go down your leg, stop. If it feels good, then continue. Sometimes it will hurt. The first time, it'll hurt your back. As long as it's not a very sharp pain, try it again. If it starts to release and it starts to feel better, then you're doing yourself a lot of good. That pain was just from stiff muscles, and you're helping yourself along. So those are the basic exercises I give people when they're having back pain.